A warm welcome to this video, and I'm delighted to welcome back to the channel Dr. Tess Lawrie. Tess, thank you for coming back.
Thanks very much, John. It's really a pleasure to be here.
Many viewers will be familiar with yourself and your work. You're a doctor of medicine and a doctor of research, a doctor of philosophy, and you're very involved in the World Council for Health, which we see on the screen now. Now, I want to come back to that in a second, Tess, but the main thing we want to talk about on this video is this. And as far as I speak for the British people, I'd like to thank you for instigating this petition.
Thanks very much. Thanks, John. Yeah, it's a really important petition, and it's one of few that actually have garnered more than 100,000 signatures this year, you know. So it was amazing when we actually reached over 100,000 within 3 months. This is an issue that people are really concerned about and would like the Parliament to be discussing. So we actually, I'm not sure if you're aware, but we didn't get a date for the debate for 3 months. And after giving them a nudge a couple of weeks ago, they suddenly gave us a debate date for Monday, which is the day before Parliament closes. So, so we really have had to very quickly try and raise awareness about the fact that the debate's happening, which is why I'm so grateful for you giving us this time on your show today.
No, we have been promoting this petition for some time, and isn't it disappointing that British parliamentary democracy needs nudged? That really is disappointing. But this is hold a parliamentary vote on whether to reject amendments to the international health regulations from 2005. And for viewers in the States and Canada, if you get 100,000 signatures, that demands that we get a parliamentary debate. Now, the quality of that debate, when that debate is and how many people pitch up to that debate is a completely separate matter. But the point is it makes it formal. It's formally recorded on the parliamentary documentation. So, Tess, why did you start this signature, this petition? What are you concerned about?
We are concerned that there is a concentration of power being placed in the World Health Organization without really having a discussion about whether they did a good job during COVID. So
I think that's a fairly short discussion, Tess, isn't it? Sorry, I'll try and be serious. Yeah. Please.
Well, it was brought to our attention early in 2022 that there were two documents that were currently, one was being drafted, the other was being revised or amended, and both of these increased the power of the World Health Organization, in particular its Director General, in the event of what they call a FAKE, a public health emergency of international concern. So when we looked at these documents, we at World Council for Health, we put together a group of experts who did a formal analysis of these documents and raised various concerns because the documents themselves raise various issues with regard to governance and sovereignty, privacy, countering dissent, and also gain of function research, which is basically, pathogens for warfare, developing pathogens for warfare. So there were a number of very concerning issues raised, not least of all sovereignty issues of handing over power to a supranational entity that's represented by an unelected official and of an unelected organization, really. So all of these issues made us put the petition in. The petition, in actual fact, also references, you'll see it says, we're concerned that Parliament's not discussed and will not have a say in the proposed amendments to the international health regulations and the amendments to 5 articles that were already adopted in May 2022. Now, the public are totally unaware of these amendments that were adopted in 2022. As it seems are most of the politicians. Yeah. So it was partly to raise awareness of that fact. And what those amendments do, two of those 5, reduce the time for rejection of any new amendments and also reduce the time to implementation of any amendments. Now, so this is sort of sets the scene for the May 2024 meeting of the World Health Assembly, because that's when all these other amendments will be adopted. Now, another factor with the delay that happened in giving us a date for the debate is that those 5 amendments that were tabled and approved in May 2022, they actually are now, they would now have gone into they would now be passed because the time ended at the end of November. So we needed to have that debate on those 5 amendments before the end of November this year, because 18 months has now passed, and we didn't reject them. There were countries that either rejected or made a reservation. I think New Zealand was one of the countries that made a reservation against those 5 amendments that were adopted last year. And there is some question about whether they were adopted in the proper way, because it's coming to light now that they might not have held a vote. So that's another issue which we're not going to get into. But this debate is really important for us all to be aware of these issues, of this concentration of power, and for us to be able to discuss it out in the open, because we don't even know who these individuals are. The UK is called an active, are actively engaged in the process, but we don't know who those actors are. We don't know who's representing us and what they are saying. I will show you, I did bring some slides, and I will show you that in actual fact, the amendments that were tabled last year and that were that have now been adopted, and they actually, the UK government was actually part of those proposals, the amendments to reduce the time. So we need to know why, and who were these individuals who were negotiating this on behalf of us, not even proposing it.
And the fact that it's going to go through, as I understand it, by default. I think the Philippines have probably raised concerns, Slovakia have raised concerns, but countries like the United States, Canada, the United Kingdom, that traditionally have fought wars to maintain sovereignty, and now it just seems to be being frittered away. It really is quite hard to understand. And I know a lot of people watching, Tess, are concerned about global centralisation of power, unelected representation, unelected power, monitoring, control. All of these things are really major concerns, and anything of that nature is a concern. We seem to be moving towards this centralisation. In the past, it's been possible with brute power and things like that, but now with electronic control and surveillance, there's so much more possibility that people are concerned about. Let's hope that this treaty does none of those things, but it is a concern. Just before we dive into it, Tess, a few years ago you started this group here, or you were one of the co-founders of this group, I believe. World Council for Health. Sounds pretty good to me.
Yes.
Give us a few minutes on it, if you don't mind.
Well, I'd love to tell you. So, we are a people's initiative. During COVID, there were lots of scientists and doctors and lawyers and others who just thought there's something funny going on here, and people aren't getting a say or a choice in what happens. So we formed this organization. And we have no conflicts of interest. We're not funded by a big pharma or anything. We're funded by small donations through the website. We also hold events like conferences and so on to educate and inform. But we are really about helping people take control of their health. And we envision a world where everybody has exactly what they need to stay healthy, to get healthy, stay healthy, not only for them, but their families, their communities, and their environments. So we really are, a people's advocate, shall we say, and we are a health advocacy group. And I'm really pleased that you actually want to know something about it, John, because so many people, they'll hear about us perhaps, and they might think, well, let me Google and go to Wikipedia. And on Wikipedia... Wikipedia, you'll hear that you'll read we're a pseudo-medical organization. We are not a medical organization. We are. Are
you a pseudo-medic, Dr. Lawrie?
Absolutely not. And we're not anti-vax either, are we not, we are not for COVID vaccinations because we know that they are dangerous now. Yeah. I don't mind if you feel you have to edit that out.
No, that's a specific point of view. We know that COVID vaccines have well-identified adverse reactions. That's not,
yes.
not a debate anymore.
And that has led us to question and issue cautions against many of the other vaccinations at this stage until we have some clarity on Big Pharma's role and the regulators. But
I don't want to be give the impression that we're against vaccines per se. I mean, for what it's worth, my understanding at the moment is that vaccines are still effective against a range of diseases. But what I do feel is that, especially the paediatric community, needs to step up to the plate and give evidence for the interventions that it is carrying out globally. So,
absolutely. We do need evidence.
We might not agree on the detail, but we really call for evidence on what we're doing.
Yes, everything we do should be evidence-based.
Yeah, emphatically so. Yeah. Now, this must have cost quite a lot. You've sent communications to all, British members of Parliament.
Yes. Well, what we did was after we'd done the evaluation of these documents and we produced a policy brief, we sent that policy brief to all MPs. So it's quite a hefty document. It's about 45 pages, but very nicely laid out and very accessible with the different issues. And also a summary of the policy brief and a covering letter highlighting the issues. And we sent a copy of the WHO's article by article compilation of the proposed amendments, because although many MPs might respond to say there's no issue of sovereignty or there's no issue of that, most of them haven't actually even had a look at the document. So at a cost of £1 per copy of the WHO's document, we printed that as well and delivered that into all of their post boxes at Parliament at a cost of £4.50 for the whole package. And that was funded by public donation. So people really care about this issue.
And I think that's so important, Tess, because no member of Parliament can now say, but I didn't know.
Yes.
They do know. You've furnished them with accessible information on this. They do know, if they bother to read it.
Yes. I just want to get a copy of it so you can see. Here we go.
Yeah.
So this is the WHO's compilation. In their original copy, it's not in red; it's just in black and white, and they're underlined. But we've highlighted so that it can be easily noted. You'll see just looking through it. Oh, sorry.
It's quite a subtle document, that, isn't it? Well, very often it's not, but sometimes they just like cross out a not.
Yes, exactly. Or
like before compulsory instead of not compulsory.
Exactly. They just say, instead of may, they say shall.
Yeah, yeah.
And instead of...
somewhat changes the meaning.
Yeah, absolutely. Anyway.
And of course, the other thing that's concerning is I get lots of people saying, well, on the comments, thousands of them saying, well, I'm not going to do this. They're not going to force me to conform. Well, actually, if it's got the power of the nation state behind it, they are going to make you conform. Because they'll cart you away to prison if you go against the laws of the nation state, and that is the concern here, that the WHO seem to be almost sort of taking over the powers of the nation state, and that is quite concerning. Yes. But I think we've got some more examples of that further down. So should we have a look through some of your materials here, Tess? Just to
yes, okay. Well, this is just a slide saying that we were founded in 2021. We're a people's health advocacy initiative funded by donations. We have no conflicts of interest, and we're managed by EBMC Squared, which is a community interest company that's not for profit.
So it's a non-for-profit organisation.
Yes.
Sounds good. Unlike other organisations that could be mentioned.
Yes.
Which are for profit. And
that's our vision. We have a vision of a healthy, free and sovereign world where everyone has what we need to generate, sustain and protect our own health and that of our loved ones, our communities, and our environments.
I like the idea of taking an intervention that's optimized for my health or whoever I'm treating at the time, rather than being optimized for someone else's financial interests. I find that a very attractive principle of healthcare.
Yes. Well, in actual fact, what I didn't mention is that we are now represented in 55 countries. We gather together we're a coalition really. We gather together groups, different organizations that are wanting positive change, wanting a more integrative approach to health, a less big pharma approach, more preventative approach. And we're working together with them, and the next step really is establishing country councils. So you'll see the little logos at the bottom. Those are the country councils we've established already, and these country councils then are preparing their own policies that are suited to local needs and taking the message forward of helping people to take control of their health in a preventive way, and looking to natural remedies and nature's remedies as well to get healthy, rather than relying on drugs and drugs for life sort of thing.
Drugs are great when you really need them. But most of health, I think, is determined by environment and lifestyle. And we need doctors to prescribe specific drugs in specific situations, but the idea of a pill for every ill is a little simplistic.
Exactly. We have to have a blending of, the allopathic as well as natural remedies and natural approaches, so that we don't have, we don't just rely on taking things, but realize there are actually certain behaviors we can do, certain natural, we need to spend more time in nature anyway. I always think that if you're not well, the first thing is really to think, is there something I can change or I need to change? And we often think, I can't change that because, and it might be your job, or it might be, but in actual fact, when you're ill, it's often a signal that you're working too hard, you're doing, something, eating too much sugar, whatever it is, and it requires a bit of self-reflection and some change.
Mm-hmm. And simple knowledge, which you are providing through your materials. Yes.
So our mission is to raise awareness about the cause of disease, rather than thinking, you've got disease and then you just, you take a pill for life, as I say. It's about educating people on how to get healthy, and about creating integrated health systems to give people choice. We all need a choice.
Yeah, and prevention is better than cure.
Yes, I'll make number 4 that.
Yeah.
So this is just to get people, to help them understand there's actually the strengthening of the WHO is actually a 2-track process. There's the WHO Pandemic Treaty, and people often get confused and they think it's one and the same thing. The WHO Pandemic Treaty is one thing, and the International Health Regulations 2005 amendments is another thing. The WHO Pandemic Treaty is going to be a legally binding treaty, or it's also called a CA2+, or an instrument, but it is not legally binding yet because the document has only been in discussion since December 2021. But the amendments to the international health regulations are a more immediate threat, because that is already a legally binding document. And so amending it they seem to be acting as if it's some sort of trivial matter of, changing something small. But they're actually making quite significant changes that will only require a simple majority vote in the World Health Assembly next year. Mm-hmm. Yeah, now, I do just want to raise the fact that there are many that say, the UK still has to pass an act or something to adopt anything. But in the first instance, we need to make sure that the changes that are happening are not, that are not harmful to our sovereignty in any way. Should somebody representing us not put their hand up at the WHO when they should, or we shouldn't have to be on the back foot with it. So we shouldn't let them take out words like non-binding so that the WHO's advice becomes legally binding, and then have to somehow back foot and make sure that the government doesn't quickly pass through something. Like it did during COVID, there were lots of laws suddenly passed without the public engagement and discussion. So it feels like these amendments shouldn't happen. So that they make that whatever process might be needed, because it's not definite in our parliament. Because it's
And an emergency is what the WHO says it is, basically, existing when it says it is.
Yes,
and even if there's no emergencies, I mean, some people might be cynical and think emergencies can be generated.
Yes, if you could just click the button, there should be a little label that pops up, because both of these documents, what they do is they create a new supranational body that gives the WHO legally binding global authority over public health emergencies of international concern. And the concerning thing for us is that they get to declare the fakes. So, so I have a bit more information on that if you want to go on to the next slide.
Yeah, I have noticed they've been talking quite a lot about climate change lately. Legitimate concern, needs debated, needs discussed, but perhaps not quite in the area of responsibility people have considered the World Health Organization to be in previously.
They're putting everything under one thing, and they're calling it health security and One Health. So they want the environment and the animals and everything to fall under the same thing. And, if we need a jab for something, then the animals get jabs for things, and the plants are being given things as well. So there's definitely it's definitely not a good idea to have everything in under the WHO's control.
I really must do a video on natural ecosystems at some point, Tess, but that's for another day.
So this is our policy brief on rejecting monopoly power over global public health. It's about both the documents, and it just puts it in context because the documents are complementary, and they're complementary instruments of international law.
And people can download this test, can they?
Yes, you can get it at the bottom of that slide. You can see worldcouncilforhealth.org/policy. It's on every slide. So some of the international health regulation amendments, if adopted, will hand monopoly power over aspects of global public health to the WHO in the event of fakes. And some IHR amendments were, as I mentioned earlier, apparently voted on in May 2022, and most of the others will be voted on in May 2024 at the World Health Assembly meeting.
Mm-hmm. And if ordinary people like me watching this video are confused, then I'm certainly not convinced that my politicians are all over this by any means at all.
No. So what our conclusions were, and I wasn't one of the experts in this group, so just so that you know. So these two WHO documents raise serious questions regarding the future of governance, i.e. do we want a central global government, and what does this mean for democracy?
No, I don't personally, but you may.
Especially not with the Director General of the WHO.
He wouldn't be my first choice.
No. So it also raises serious questions regarding the future of free speech and the right to dissent.
Yeah.
The future of the right to privacy. The extent of digital surveillance and private data mining, because we don't know who will have access to all of our NHS data. The control over the production and access to medical treatments, as well as the integrity of the regulatory processes, because they're proposing that they do all the drug regulations. They just have a central, so the MHRA would no longer, have a job. Then, of course,
it's not the most efficient organisation in the world, but that sounds even worse.
Yes, well, it's just getting more and more centralised.
Centralised power control.
Where there's more risk of corruption the more one centralises.
Oh, I do hope there's no corruption, Tess.
So, and of course, the future of gain-of-function research, because if you have an organisation who's in control of fakes,
Yeah.
then they support gain of function research, which is really a euphemism for making bugs for war. It's about making deadly pathogens that can harm people, and this is of serious concern, and I don't think anybody wants an organization or wants these bugs made in the first place. So to have a health organization that's happy that these bugs get shared, and then I don't think that's in public interest.
I think, regardless, I mean, this is not connected to this talk, but the way that we've been suffering from human arrogance is just staggering, and the potential for a small group of people to think that we can control a particular biological technology. Now, that's bad enough when you're talking about chemicals and nuclear weapons, but when you're talking about something that's potentially self-propagating, as a virus essentially is, it'll use our cells as the intermediate for that. And this is not just viruses either. I'm concerned about the weaponization of bacteria. I'm concerned about the weaponization of protozoa and prions. And we know that all of these things cause really significant human disease potentially. Prions may be one of the most frightening ones. A self-perpetuating protein that alters the structure of other proteins and could do so potentially in people all around the world. And we know that this works already. We've seen this from scrapie in cows, and Creutzfeldt-Jakob disease in humans, and bovine spongiform encephalopathy in cattle. We know this is a real thing.
John, you're so right though, just saying that it's a few people, and in actual fact, what we're dealing with here is a supranational entity of the WHO that only controls a quarter of its budget or less. The rest is voluntary contributions, and who pays the piper calls the tune.
So I've heard.
And these are, it's minority special interest groups that seem to have all of this influence.
Yep, and that's of course exactly what concerns us. Now, these we've gone through these on videos in the past, Tess. Well, what's your color coding here?
Yeah, I wanted to just show you. So this is the document from May 2022, where I just highlighted that this is about strengthening the WHO. And we need to ask, why do we need to strengthen the WHO? We need to strengthen our own health. We need to strengthen our national responses, perhaps, but we certainly don't need to strengthen the WHO. The proposals for amendments, I just want to point out that the United Kingdom of Great Britain is very much part and parcel of this negotiations. So we need to find out who's involved. But the other points are, those are the changes that have been made. I've highlighted that reduce the time from to reject or make a reservation about the amendments. It reduced the time from 18 months to 10 months. And it reduced the time that the amendments would enter into force from 24 months to 12 months. So that's what I've highlighted there.
Mm-hmm. Yep.
I just want you to look on the left here. So these are the main issues with the IHR amendments as we saw them, as our expert panel sees them, that the amendments give the WHO the power to make mandatory, legally binding recommendations that were previously non-binding advice. So the WHO could recommend something, nobody had to follow it. It was just advice. It increases the power of the WHO's Director General dramatically. It leads to cartel
unelected,
yes.
Largely unaccountable. I'm not sure these guys, if they want to tell me that I'm wrong on this, they can do, but I'm not sure these guys even pay tax. Tucked away in Geneva. I don't know what the tax situation is, but I can't remember voting for any of them personally. Tess, did you vote for any of them?
No, I certainly didn't vote for any.
I can't remember voting for any of them. Yeah. No. Sorry, I interrupt.
No, that's okay. But just to say that it's cartel rights, they get to choose who gets what contract, who makes what drugs, whether they're safe or not. And also unsolicited offers and obligations to cooperate. And I've got a little slide on that, which I will show examples of. But basically they say, we offer you this, and then you oblige to cooperate or explain your way out of it as to why you won't. The systematic countering of dissent from the official line. So they want to be in charge of making sure that everybody agrees they are the chief of science and health. And then mass surveillance of compliance via digital certificates. So we all have to have digital certificates or certificates, most probably digital. And in that way, they will check whether we're all doing what we're told. And then, of course, the sharing of pathogens and genetic sequence data. So I've got a few slides on the top three of those, the first three points there.
You know, I think the thing that frightens me the most, actually, is the control of information. You know, if we're not free to discuss and to question as independent scientists, and, you know, I'm not even saying I'm in that category, but, you know, you're a doctor, you have access to some of the leading medical brains in the world. If we just say to all those people, go home, shut up, you know, what? That's the thing that concerns me most, I think.
I agree, because we need, each and every one of us needs to have access to information. And even during the last 3 or 4 years, the information ecology has been so corrupted, and people haven't been able to make informed decisions because they just haven't actually been given the information or had access to it. So we're talking about that times 1,000. You know, we're basically... Yep. You just don't get, you just don't see any dissent. You don't hear any other opinions.
Of course, the great father of one of the great fathers of evidence-based medicine, David Sackett, you know, a third of his evidence-based principles was informed consent.
Yes.
What patients find acceptable.
And nobody could have actually given informed consent to many of the interventions of the past 3 years.
And if you can't give informed consent, then essentially you don't have evidence-based medicine. It's I suspect that Professor Sackett would be unhappy with that, but sadly no longer with us. But let's move on.
Yes, I just wanted to highlight, this is the article by article compilation. You can download it from our website at that address. This is the WHO document. And I just want to run through the articles with implications for national governance and sovereignty. Now, the first one is Article 1. And this is where it says that WHO can issue standing recommendations and temporary recommendations. Standing recommendations are recommendations for just that just are recommended, like you should give your child tetanus vaccination. I mean, you know, we should not. You should give your child. Your country should vaccinate children for tetanus at the age of XYZ. And the country can decide. It's just advice. The country can decide whether to take it, but it's a standing recommendation. It's not in relation to an emergency. It's not temporary. It's there to stay. Whereas a temporary recommendation would be in response to something that, that would be, we suggest you do this now, and then in 2 weeks' time we take it away. The
non-binding bit is crossed out, Tess.
That's what I'm glad you noticed that, because that's what I wanted to say. Was it used to be advice, non-binding advice, and by the simple removal of that word non-binding, it suddenly gives this entire article a different meaning in the context of what is a legally binding document.
Yep.
We can go on. So this is the other two articles. Article 42. It says health measures taken to these regulations, including the recommendations made under Article 15, which we'll get to, shall be initiated. Now, I think previously it might have said maybe or should be or something, but now it shall be initiated and completed without delay by all state parties. And then it says state parties shall also take measures to ensure non-state actors operating in their respective territories comply with such measures. So it turns our state parties into policemen to enforce what the WHO tells us to do, tells us to implement, and across non-state actors. I presume we're non-state actors.
I'm not a state actor as far as I'm aware. The state may inform me otherwise, of course, but as far as I'm aware, I'm not a state actor. No.
It certainly does make it look like the world is a stage at the moment, doesn't it?
It does.
Anyway, and then Article 43, this is really interesting. If you could just go back. Yes, it says a state party implementing additional health measures shall ensure that the measures do not obstruct or cause impediment to the WHO's allocation mechanism. So WHO has already decided what everyone should do and how it should be done and allocated. And it shouldn't interfere with any other state party's access to health products, technologies, and know-how. And if you decide to adopt any other measure, well, you have to provide reasons to the WHO. So if our country decided, well, actually, we think everyone should get vitamin D as well, you have to go and ask the WHO if that's okay. So anyway, and it goes on. So we can go on, but I hope people will pause the screen and read a little bit further.
But this is downloadable, Tess, isn't it, as well?
Yes, it is, yeah. So let's go to the next slide. So the next thing that's concerning is that the amendments to the international health regulations increase the power of the WHO Director General, who's an unelected official. And what it says is, in Article 15, when it comes to making these temporary recommendations, is that in the event of a public, it's determined that a public health emergency of international concern is occurring, and they've added, or the event has the potential to become a fake, the Director General shall issue temporary recommendations. So he is able to declare a fake if it's just a potential, actual or potential. And this is very concerning, especially if you could just click again. I've got a little comment there relating to monkeypox, because in 2022, last year, the Director General declared a monkeypox fake, and he overruled his own emergency panel. So, it was a fake, and it was very clear that it was a fake, because there was no monkeypox pandemic. Now, can you imagine giving one individual all this power and then issuing forth a whole lot of recommendations that are legally binding? And again, I can hear you saying, but hear one thinking, but my government would never, this is just a ridiculous example. But why do we want to have a document suggesting such a thing? It just doesn't make sense.
Nope.
And again, this is just to say, did the WHO or the WHO Director General do a good job during COVID? I'm not going to say anything more.
Let me think about that one, Tess. Now, I can't make my mind up.
This particular slide reflects some of the data on the WHO's VigiAccess database. It's from July 2023, and those numbers have increased somewhat since then. I won't say anything more. Please do freeze the screen and have a good look.
Yeah, I'm going to have to check on the latest VigiAccess. This database is still working fairly well, Tess, is it?
I wouldn't say it's working well, John, because what we have noticed is in January 2023, there was over 5 million reports. And so obviously there were sort of 2 million reports added during 2022 or so, or even 3. And it just seems to have slowed down to a trickle, which doesn't make sense at all. So this year, I think if you look now, it would be around 5.2 something. So it's gone up 200,000 over this year, but 2 million the year before. So it feels like there's been a slowdown of reporting or loading the data. Mm-hmm. You may be interested to know, and viewers will be interested to know, I'm sure. We actually have access to that data. We are analyzing it as we speak. We actually have it from, we have data relating to about 5 million people. And we are analyzing it. It's not the easiest to analyze, quite frankly, but we hope to be reporting soon, just because of the way it's been entered. But we are hoping to come forward with some some results that will be of interest to the public.
And these are all adverse events reported after COVID vaccines.
Yes, yes.
And
I wasn't.
No, I think we're allowed to say that now. I think, and it's possible there was a few adverse reactions that occurred that weren't reported as well, isn't it?
Yes, well, this is just a fraction, really, of what what would get reported. We know that the databases, the pharmacovigilance databases, there's a huge underreporting factor.
Yeah.
What is remarkable on that database is just the huge numbers of adverse reactions, so many different sorts. I mean, the range of things, and all sorts of some strange diseases we haven't seen before. Yeah, so I wanted to speak just about just give an example of unsolicited offers and obligations, and it's really related to this. So, for example, with Article 13, the public health response, what happens when a fake is declared or a potential fake is declared? Well, you get an offer of assistance. You get an offer of assistance from the WHO saying, we want to help you. And then we have to accept that offer, or we have to give reasons why we don't want that offer. So in my mind, this is a bit like you get a letter in the post, and it says, we'd like to offer you insurance on your vehicle or something. And then you can't just tear it up and put it in the bin. You have to respond and say why you don't want that offer of insurance. Does that sound like a similar analogy? I mean, I was trying to think, because it really feels like, it's one of those annoying things where you didn't ask for help in the first place, but now you have to act in response to something and explain your reasons why. Why would we have to explain if we've got everything under control? Why would we have to explain why we don't want to take the offer? And it even goes, I think if you just read here, so regarding on-site assessments, in compliance with its national law, a state party shall make reasonable efforts to facilitate short-term access to relevant sites. In the event of denial, it shall provide its rationale for the denial of access. Now, this is like someone pitching up at your house and saying, I want to just go in and have a look in your bathroom. And you saying, you would say no. But instead of, in this case, you'd have to give reasons why and explain rationale to deny access. So there's something really,
uncomfortable
about this. Yeah. And then this is Article 13A, which really speaks to sovereignty again as well. And this is state parties recognize WHO as the guidance and coordinating authority of international public health response during public health emergency of international concern, and undertake to follow the WHO's recommendations in their international health response. So you can see again,
interference potentially in national sovereignty.
Yes. If we can. Yeah. So this is this is just a quick summary, and it's a part of what was sent, the covering letter that was sent to MPs. I'm just getting back to the petition. There's obviously so much you can talk about this document. It's it's a long document. It's mostly read, so most of it has changed. But I just wanted for the public to guide them. This was what we sent to the MPs to guide them. We highlighted that Article 3 is worrying because it suggests the removal of full respect for dignity, human rights, and fundamental freedoms of people as the overarching principle of the IHR, and obviously that needs to be the overarching principle of the IHR. It also it has the issues regarding sovereignty and those changes to Articles 1, 42, 43, and the entire new Article 13A and Annex 10. The amendments to Article 15, which expand the powers of the Director General. The amendments to Article 44 and Annex 1, which relate to systematic countering of dissent. And amendments to 23, 35, and 36, Annex 3, 6, and 8, which relate to surveillance of compliance with the centralized dictates via digital certificates. So we would like at least a discussion around those articles, because we feel that those are, they're the sort of main key issues. There's so much that can be discussed, but if we could just discuss those.
I mean, I just find the audacity of this outrageous. It's just...
But audacity on whose part? Because it seems like our government is involved in the drafting of these.
Yeah. Just...
We can go on.
Quite incredible.
So this is just, I put this in, people can look through it. It's in there, Article 18, and it's just an example of the sorts of things the WHO could be recommending to state parties with respect to persons, which I believe is us. So they might say no specific health measures are advised, or they might want a review of travel history. You'll see the thing that they've added at the bottom there is contact tracing and all sorts of stuff, travel itineraries and things from us in the event of travel. They might want review of proof of medical examination or lab analysis. They might require medical examinations, review of proof of vaccination or other prophylaxis. They may require vaccination or other prophylaxis. They can place us under public health observation. They can to implement quarantine or other health measures for suspect people like us. They can implement isolation and treatment where necessary of affected people. They can implement tracing of contacts or of suspect or affected persons. I mean, we sound like criminals, don't we? Refuse entry of suspect and affected people. Refuse entry of unaffected people to affected areas. So I think this might be, stopping us going to visit our relatives and that sort of thing. They can implement screening and restrictions on people from wherever. So, it's really far-reaching. And you might say, well, it might never happen. Pandemics hardly ever happen. Public health emergencies hardly ever happen. They happen once in a blue moon, decades apart. But that doesn't seem to be the case lately, with 2 pandemics declared in the last 3 years, and I'm talking about the COVID pandemic and the monkeypox pandemic. So further reading, please do go onto our website, worldcouncilofhealth.org and /policy. You can download the summary. If you just want a quick summary, very accessible. It's just 7 pages, big text. And the more detailed one, if you want a deep dive, please do download and have a look at the article by article compilation. You can use the little, those 10, that there's a slide, you can use a slide deck with the guide to the articles that you can look at. You don't need to read the whole thing, although it does make for interesting reading.
And have a word with your politicians.
Yes, please. I mean, that's the whole point, is get to know what's going on, and then help your politician see and listen and participate in what's going on. It would be really great to see a full house on Monday on this topic. Yeah.
Tess, on behalf of everyone that I'm able to speak for, at least, thank you for what you're doing. Huge amount of work. I know this is in addition to inconveniences like needing to make a living and other things like that you have to do. So thank you for what you're doing, and it's just every time you read through this, you're just taken aback afresh by what is going on here, and but for highlighting it, we appreciate it. Thank you very much.
Well, thank you, John. You're doing such amazing work, and it's a real honour to be speaking with you today.
Thank you for coming.